Okay, I think we'll get going now. We've got quite a lot to get through, as you might have seen on the invite. Good morning, everyone. I hope you have managed to get a brew on. Cheers. And settled and ready to listen to some of our stories of co-designing digitally enabled health and care in Leeds. So this is the agenda for today. And as you can see, we've got quite a lot going on. In a moment, Kirsten's going to, I'm going to give a bit of context from mHabitat's point of view. Kirsten's going to talk a little bit more about our inclusive co-design approach. And then we've got a mix of stories, really. We try to sort of pick out a flavour of the kind of work that we get involved in. And it's in partnership with all sorts of sectors. So we've got Volition here from the voluntary sector, we've got the NHS, local government, and industry as well. And we'll be sort of talking about some of our flagship platforms and programs and training and events and so on. And at the end, we'll do a little bit of a wrap up and hopefully send you on your way for the rest of the day. Could you move to the next slide? So here is the core team at mHabitat. You'll also be able to see them on the screen live, hopefully most of them. And you'll get to meet most of these people in the next hour. Gemma Lee, who's in the bottom right hand corner, is our events coordinator, and she's in the driving seat today as the tech lead. And I wanted to mention that mHabitat has been going since 2014 and was set up by the brilliant innovator and friend of mine, Dr. Victoria Betton. And Victoria and her team, they went on quite a journey together, and they've really clocked up an amazing array of projects. And the majority of the current team started around the same time as lockdown hit. And whilst we each bring our own sort of unique bundle of talents, networks, and ideas and insights, we have slightly pivoted the focus of mHabitat. We have a really similar set of values and goals. And I always like to describe us as sort of the sugar babes, because we're the same brand and genre, but we're a different lineup. So the other important thing to note is that although these people here are the engine room of mHabitat, we're actually more of a collaborative, and we have a really incredible array of specialists, expert associates and partners that we work with on different projects. And that includes the brilliant Anne Cooper, Jane Wood, who I think is in the audience today, Zoe Limbert, Sheldon Steed, Tim Brazier, Stuart Harrison, Ian Sharp, AUP, Hive, HMA, and many, many more. Internally to Leeds and York Partnership Foundation Trust, who look after us, we report to the Deputy Chief Exec, Dawn Hanwell, and we work quite closely with the CCIO and the CIO and many other parts of the trust. Oh, and I must mention that, that in a couple of weeks' time, we're also going to be joined by Pete Nuckley, who's going to come in as our Deputy Director, and he's been heading up the NHS Widening Digital Participation Programme at Good Things Foundation. So we're delighted to be welcoming him. Could you move on to the next slide, please, Kirsten? So as mentioned earlier, our mission is all about ensuring that everybody benefits from digitally enabled care. We use a blend of methods, primarily co-design, but we blend that with social change, community development, digital and management approaches and tools. As you can see here, our values are here, and they're really important to us. So integrity and quality, curiosity and creativity, inclusivity and respect for diversity is really, really important to us and underpins all of our work. And our services are really, we sort of split our services up into four. We have bespoke inclusive co-design projects. We do research and evaluation. We have a small number of specialists, larger social change programs and platforms, and we run training and events, all of which contribute to our mission. I felt that I couldn't really do this presentation without also sort of talking about COVID-19 and how that's transformed our way of working. You know, as I mentioned earlier, we more or less got together as a team at the very start of lockdown, so we had to go straight into remote working, and that really changed how mHabitat works as a team internally, but also how we deliver our services. So we are now able to deliver inclusive online workshops and events and so on. And the only other thing I really wanted to sort of highlight really at this point was our sort of a big focus on inclusive digital transformation. And as many people here will be aware, there's even before COVID, there was a lot of time and resource and effort being pumped into health and care to digitally transform it. But actually not too much attention paid to the inclusivity end of it. And this is why it's important. So there's about 9 million people who don't have all the digital skills and access they need to actually benefit from digitally enabled health and care. And these people are more likely to be older, living with disabilities, living in poverty and so on. And many of us will know that those groups of people are more likely to need health and care services. So there's obviously a flaw in the system. And what we work with is that we try to understand, what is it that gets in the way of people using digital and benefiting from digital. And we know that there's 3 sort of interrelated risk factors. And one part is about your life context. Another part is about digital skills and content and capability and access to devices and data. And the third is about what's happening in the system. So the design and accessibility of tools, user experience, the digital confidence and capability of staff, etc. So we think inclusive digital transformation is really important and is a key part of our work going forward. So now what I'm going to do is hand over to Kirsten, who is our lead co-designer, and she's going to talk a little bit more about what inclusive co-design means to us.
Thanks, Roz. What I need to remember now is that I need to move the slides for myself, so I need to get my things in order. So thank you, Roz, for the introduction, and thanks everyone for joining us this morning. It's really great to see so many people joining in. So my name's Kirsten. I'm going to talk a bit first about co-design. I expect that most of our audience here today are joining in, maybe because you know a bit about co-design already, or at the very least, I hope it piques your interest. So my job is to give a taster as to what this means for us as a team, and warm us up a bit, really. It is a bit early after all. I hope everyone's got a cup of tea or coffee. And then once I'm done, I'll hand over to my wonderful colleagues and the show and tell examples that we've brought along today. So to get us started, I wanted to set a bit of a challenge, and I wanted everybody to type into the chat the first word that comes to mind when you think of co-design. And we'll wait a few seconds to see those coming in. Don't think about it too much, just the first thing that comes into your head. Lovely, so I'm sure you can see those coming in. I'm really happy to see the first couple were people, together, inclusive, collaboration, user-centered, public, partners, wonderful. So absolutely, the fundamental thing to remember with co-design is that it's all about people. And that's personally why I love it. It's about working with people and designing things with them, not for them. It's about creating the conditions and facilitating a process that allows people with lived and learned experience to be the solution makers. And importantly, this is a collaborative process that allows for there to be shared understanding and power across a diverse group of stakeholders. So it's really, really good to see a lot of those words I've just said coming through from the chat as well. So when we work on co-design projects, we involve and bring together groups of people who represent those that are affected by the problem or who will ultimately benefit from the solution. It varies by project, but for example, it might include people who access a particular service, so patients and their caregivers perhaps, health professionals and staff, commissioners, and we work together along with tech developers in the room to try and solve the problems and understand how we can help. So I guess through all of this, we're learning all the time and discovering new things, understanding what drives people. And then importantly, we also need to test out what the solutions that we put together and make sure that they actually work, find out what doesn't work for people. So for, I guess, the co-design process to work, we have to be all of these things in that bottom level in the palest purple circles. So open, flexible, iterative, inclusive, accessible, respectful, and importantly, we need to be curious and creative. And we need to encourage these ways of working in our partners as well. And you'll see that they link back up with the values that Roz presented for our team, and there's a very good reason for that. So I guess one of the challenges we've had to overcome this year, and Roz gave a bit of a nod to this, and there's been a few challenges for all of us, haven't there, in 2020, But I guess the main one for us in terms of delivering our work was, how do we run co-design processes that are all of these things without being able to be physically in the same space as the people we're working with? So I've got some pictures. So this first picture on the left-hand side is a snapshot from the last in-person discovery session that we ran back in March of this year. So as you can see, there's paper, post-its, coloured pens, drawings, teas and coffees and snacks on the table. So that's kind of a good kind of snapshot into sort of how we did things when we were able to be in the room with people. And it feels worlds away now. I guess what's not seen in the picture is a group of 10 people moving around, talking, listening to each other, sharing, challenging each other, and coming up with ideas. So as a team, we've had to spend a lot of time thinking and testing things and considering what different people might need, and tailoring what we do really for different projects and different groups of people. So we are in a position now where all of our projects are running remotely, and we're using a range of different tools and techniques. So a couple of snapshots here of from some outputs from some sessions we've run. We've had lots of fun using virtual collaboration tools and so on. And there's lots of fantastic content out there from other people that are doing the same thing. And as an industry, I think there's been lots of sharing, which has been really great. We're also sort of building in digital inclusion budgets into our projects, so that if there are some people who need some help to be able to join in with our work remotely, we can help them to do so. Because I guess we absolutely don't want to exclude the people who need to be involved just by the nature of the way we do things now in this remote world. And I guess whilst we have had fun with these tools, we're not afraid to go back to basics as well. So, we're very aware that for some people, joining a session like this might not be something they want to do or are able to do. So picking up the phone and talking to people in that way and other ways of reaching people are things that we're considering and building into our projects as well. So it's not been easy, and we're definitely still learning. But I guess that's what all this is about, isn't it? Being flexible, iterating, trying new things and keeping the ones that work and losing the ones that don't. So I hope that serves as a bit of an intro to sort of how we do things. At this point, I'm going to hand over to Sana, who's going to start us off with a conversation with Nicola from Volition about the MindWell platform.
So I'm Sana, I'm the Evidence and Evaluation Leader at mHabitat, and today I'm joined by Nicola, who is the Content and Communications Manager at Volition. mHabitat and Volition first launched MindWell on World Mental Health Day in 2016. The award-winning platform has been co-designed to provide a single go-to place for information about mental health and local services in Leeds. Since then, the site has had a huge impact with over 1 million hits, achieving or exceeding 5,000 hits per month. It has nearly over 200,000 users and nearly 60,000 hits on the I Need Help Now page. I started mHabitat at the beginning of the year, and I've spent a lot of time working with the team at Volition on MindWell, and Nicola has been on the MindWell journey from the very beginning. So today we thought we would tell you about the journey of MindWell and our involvement. Nicola, you worked on MindWell from the beginning. Could you tell us a little bit about how MindWell came about?
Yes, good morning, Sarah. Back in 2015, the NHS Leeds CCG took feedback from people in the city that it could be difficult to know how to look for information to support their mental health. So they decided to commission a portal that would bring together information from the NHS, Leeds CCG, from the council and from the third sector into one place. mHabitat was appointed to manage the development process, and I came on board to create all the content for the new website based at Volition, which is a forum for third sector organisations that support people's mental health in the city. So we literally started working together from a blank piece of paper.
Yeah, and could you tell me a little bit more about how MindWell was developed in that co-design process?
Yes, MindWell was created through, as you just said, a co-design process involving so many local people. So that included people who use services, carers and professionals, healthcare professionals, and also employers, all kinds of all kinds of people came together in co-design workshops, and that helped steer development. So everything from the content sitemap, the tone of voice, and the branding were all developed through co-design. Since going live, my role has developed, and I now look after a small team at Volition that produce content communications and do day-to-day engagement activities. And the partnership between mHabitat and Volition continues.
And who is MindWell aimed at?
MindWell can be used by anyone in Leeds. You could use it for yourself if you're worried about somebody, or if you're a professional supporting other people. We've got loads of resources to take care of your wellbeing and services where you can self-refer. So you don't need to have seen a GP or have had any kind of diagnosis to start using it.
So MindWell has had a huge impact. In March this year, we did an evaluation, and then we saw the many different ways MindWell is used. So, for example, it's used in the A&E for second care at home, and more practitioners will promote it over the Christmas period when departments are shut. I was wondering if you could talk a bit about the impact you think MindWell has had.
I think for many people, the healthcare system can appear complicated. So MindWell was designed to make it simpler and easier to access. It's written in plain English, and it's been designed to be clear, friendly, and easy to use. I was talking to a wellbeing practitioner last week who described to me how it had changed her practice. So from before MindWell, she used to search the internet a lot to find different resources to support the people that she was working with, and different services that they could use. But when MindWell was launched, it was all there ready for her to use. She also said that our self-care resources are second to none, and we get that feedback a lot, that the resources that we produce really help people to better understand common problems like anxiety and stress. Our campaigns are also becoming really popular and creating a lot of impact as well. Back in May, we ran a campaign for Mental Health Awareness Week around the theme of kindness, sharing different resources every day around being kind to your mind and your body and other people. And this achieved 150,000 Twitter impressions. And we started to, it really went viral. We started to get tweets from all over the country. We also recently ran a campaign for World Suicide Prevention Day. Again, it was really well received by the city. We shared lots of resource and information for finding help in a crisis. And next week, we're launching a new campaign for World Mental Health Day around the theme of coronavirus and mental health, and how it's impacted our well-being, both in different ways, including positive ways. And we'll be sharing some art projects that have been taking place during the pandemic as well.
Thank you. And I guess one of the things that's impacted everyone this year is obviously COVID-19, and MindWell has provided multiple resources on the site to help those impacted. The Coronavirus Mental Health Information Hub provided self-care videos, online support, and in the first month we know that it had over 4,000 visitors. Nicola, could you tell us a little bit more about this, please?
Yes, back in March, the MindWell team were really faced an unprecedented situation, as we experienced kind of like a tsunami of information and emails from services who were having to adapt to social distancing measures and changing the way they could support people by going online and by telephone support. So we decided to launch the Mental Health Information Hub to give people up-to-date information about how they could find support during the pandemic, and also lots of digital tools that you could use to support your well-being while you were staying at home or working from home. We also worked with the Volition team to create some paper resources for people who are digitally excluded. And though we feel very passionate about advancing digital inclusion, we also don't want to leave people behind who need, at the moment, some paper information. And we're also translating resources into different community languages, which we're going to roll out soon. And I think the pandemic has really brought forward a conversation around how we can support different diverse groups and different communities in Leeds.
Yeah, and it's it's been the same for us as well. We've gone from conducting face-to-face co-design workshops to having to move it online. And for yourself, you guys used to do engagements face to face. How have you found it moving engagements online?
Yeah, we used to do a lot of live events and run stalls for people in the city. But since obviously the social distancing measures, our engagement officer Zoe has moved a lot of our activities and staff training sessions online. And although we miss some of the face-to-face contact, we can actually reach more people through this medium. For example, we're doing a joint session with Public Health next week around mental health information in the city for 60 professionals. I'm really looking forward to that.
Perfect. And lastly, what are some of your best moments whilst working on MindWell?
It's always really great and satisfying to get good feedback from people that we meet. I remember one student who approached me at a stall and told me how MindWell had really helped to reduce their anxiety in their first year at university, and that really stuck in my mind. But also when we won the Plain English Award, that was a really proud moment. And also last year when we won when MindWell won the Tech for Good Award at Leeds Digital Festival Awards, that was a really great moment to win an award in Leeds.
And so I've been asking more questions, and I know we're running out of time now, but have you got any questions for me?
Yeah, so Sana, we've got some really exciting news about the future of MindWell. Do you want to tell us a bit more about that?
Of course. So we've got funding for a new website, which is great. Accessible, and we're going to use what we know as part of a wider review and development of the platform. We'll also include and explore digital inclusion with further integration into services and developing a deeper understanding of its impact on the city of Leeds. There's a lot of exciting things ahead. Is there anything you'd like to add, Nicola, before we finish?
No, I'm really excited about the news as well and how we can better support people with different accessibility needs. It's going to be great.
Next slide, please, Kirsten. I guess I'm passing on to Gemma.
Oh, sorry, no sound there. Morning, everybody. Hi, my name's Gemma Wormold. I'm the Link and Facilitation Lead for mHabitat, and I'm going to be chatting to Richard Gurney. He's the Digital Exemplar at the Leeds and York Partnership Foundation Trust. Morning, Richard.
Morning, Gemma.
How are you?
Very well, thank you. How are you?
Good. Yeah, good. Me and Richard are both OTs by background and then spent time working in mHabitat. Richard had 2 years secondment, was it?
Yeah, that's right.
Lovely. And then I moved to the team the end of January, just as the COVID struck, like the team said. So, Richard, do you want to tell us a little bit about how the Digital Exemplar programme began?
Sure. So back in 2016, NHS England were looking at how we advance technology across healthcare, and NHS Digital were doing digital maturity assessments of all NHS trusts. That came together with the Global Digital Exemplar Programme, which ran in 2017. Now, to qualify for the programme, you had to be one of the top 7 mental health trusts, or I think it was 13 physical health trusts, on the digital maturity scale that NHS Digital had just done. Leeds and York Partnership Foundation NHS Trust is a medium-sized mental health trust. We see about 1 million contacts a year. We have 2,500 staff spread across Leeds, York and the north of England, providing mental health, learning disability and specialist services. And in the digital maturity assessment, we came out somewhere in the middle, which I guess is what you would expect for a medium-sized trust doing what we do. So unfortunately, we didn't qualify for the Global Digital Exemplar Programme, but a seed was planted in the mind of Victoria Betton, previously mentioned by Roz, and also with the informatics leadership at LYPFT. And our ambition was that we would get ourselves to a place where if the Global Digital Exemplar Programme was run again, we would be in a position to take advantage of it. We had the digital maturity scores from before, so we knew the areas we were strong and weak in. And I was employed for 2 years to try and bridge the gap and get us to a place where we could qualify.
Lovely. And how has that progressed since the very start? How's it going?
Well, I suppose it's fair to say that the goalposts changed fairly early on, because it became increasingly clear that NHS England were not going to run the Global Digital Exemplar Programme again. And so we decided to make a strategic shift to move away from the predefined goals that NHS England had set to goals that met the local need more closely. And for us, that meant looking at a number of different projects, I suppose. We are, as many mental health trusts are, we're quite far ahead digitally. So it was mental health trusts that took on electronic patient records first and electronic prescribing. And that's because of the user base that we have. The prescribing tends not to be as complicated. The number of service users or patients that we see tends to be smaller. The staff group is smaller and more easily defined. So we'd already had an electronic patient record for 10 years, but we were looking to re-procure a new one. We already had e-prescribing, but we wanted to move it further and do more with it. So they were two kind of flagship projects I was handed by the trust to try and work on. And being bedded in mHabitat gave me the opportunity to really focus on a co-design approach for that. And that's often not the case with big infrastructure projects, which by definition have to be kind of fit for purpose for lots of different people. So reporting, for clinicians, for finance, for all the different groups. So they were kind of two projects that were handed down to me. But in the spirit of co-design, I wanted to go out and find out what other projects people were interested in. What were people doing already? I didn't want to reinvent the wheel. We've got some really innovative clinicians and admin staff working for us, and I wanted to see what they were doing. So the whole first 3 months was spent on research, really, going out and speaking to people, gathering as much information. I think I spoke to over 200 people in those first 3 months, not just clinicians, but also reaching out to the Global Digital Exemplars to see what they were up to. I spoke to third sector organisations who were often much more innovative and agile in the way they approach, I think as Nicola just described for MindWell. And also went out to NHS England, NHS Digital, NHS Improvement, to see what they were looking at further down the line and to see what we could steal and what we could get ahead of the game with. And I think we've got a slide of I think it's 11 different projects that we ended up settling down on. And they ranged in impact. And I think that was the key, really. Whenever we plan a project like this or a program like this, you always asked about how many people you're going to impact, and that's often something you score against. But some of the projects I'm most proud about had the impact on the fewest people, but that impact was huge on those people. So one of the projects was to look at how we make the systems that are used by the clinicians in the trust more accessible to people with sensory impairments. And I'd been part of a project with mHabitat where we'd gone out to look at how people with sensory impairments access GP surgeries. And again, that seed stuck in my mind to think about, well, the population of 2,500 clinicians must have a degree of sensory impairment in some of those people, and how they accessing systems that I take for granted. So we did a project, and actually we only impacted on 4 people, but we changed the way that they access and the way that they work completely. And so for me, that was as important as the projects where we affected the whole trust.
And then where is the project likely to go, or is there any other moments that you sorry, I'm so croaky.
No, don't worry. I guess there's a load of potential coming up. I guess when the project came to an end, so it was about a 2-year project. As always, timescales shift backwards and forwards a little bit, and we'd got most of it done within the 2 years. When the project came to an end, my attention shifted to the implementation of our new electronic patient record. It's a big project. It was kind of all hands on deck. And then literally the day we were going to go live, we went into lockdown. So we had to make a snap decision about whether we were going to go ahead or not. There were some really good reasons why we went ahead around allowing remote access to clinicians, which we wouldn't have been able to on our old system. So we went from having about 150 people working remotely to 2,000 people over one weekend. And we were able to stand up a whole new electronic patient record, including migrating information from the old one and providing a virtual floor walking function over one weekend in lockdown. So I think that's a huge achievement, and I think we're all really proud of that. We maybe haven't got the full benefits out of the system yet because everyone's in lockdown, but we're getting there for sure. I think looking further back, one of my proudest achievements, apart from helping the people with accessible equipment, was certainly moving the electronic prescribing into the community. I think prescribing is a huge issue for people out of hours. Generally, prescribing is done on paper cards, and those cards are locked up in filing cabinets overnight. And that works fine in an outpatient or GP setting where people don't present out of hours, they go somewhere else. But for mental health services, people can present 24 hours a day, 7 days a week, at multiple sites across Leeds and York. And our on-call doctors work across, the whole setting.
They do.
And you might need to prescribe urgently in that moment, and you need to see someone's allergies and what's going on for them, what they've had before and what they've already been given, and all these different risk factors. And what we used to do was send someone out in a taxi to unlock a building, go to the filing cabinet, get the card, get back in the taxi, lock the building up and go back. And that could take hours sometimes, depending on where the doctor was and where someone was who had the keys. And you can imagine the logistics of all that. And we managed to roll out the electronic prescribing system to our community services who work out of hours. And we think we're one of the first mental health trusts to do that. We are one of the first. We think we are the first to manage to have the same e-prescribing system on inpatients and community. And it's made a huge difference to the service that our patients get. And that's the most important thing for all these projects. So yeah, I think that's where we are now. Moving forwards, we've got some other big infrastructure projects coming along. As I said, we want to become as digitally literate as possible as a trust. So we're doing lots of education work with staff. Obviously, 2,500 people have 2,500 different experiences of digital and 2,500 different levels of digital acuity. And so we are trying to bring everyone to a basic level through education and mentoring and support and coaching. We are looking at creating a portal where we have one version of the truth for everything from a clinical perspective. So you log onto one system and then it allows you access to the system of systems. So you might log onto our electronic patient record, but then be able to see the e-prescribing, be able to see someone's test results, be able to see someone's mood diary that they've entered on an app. So we're looking at lots of innovation. We're also looking at capitalizing on the increased willingness to engage in digital that some of our clinicians have, having worked through mediums like Zoom and Teams and Skype and stuff. So I think there's loads to do, and it is an exciting time over the next 2 years. So yeah. How about you, Gemma? What are you doing next?
Oh, well, I was just going to say, as a clinician,
you started doing DigiWords before I did, didn't you? So tell us about that. The
switch to care director was amazing because it was literally on lockdown. So I'll just say a massive thanks there from all the clinicians. I think I'm just going to spend 2 minutes talking about a project that I worked with mHabitat before I got the job here, and it was part of the reason that I came to work for mHabitat and made the shift from sort of traditional clinician to work in the team. So in 2015, we worked with mHabitat. The aim of the project was to create the first digitally enabled older people's wards. So we got work at the Mount, so we put tablets into the Mount. So the Mount, if you don't know, is an older people's unit. It has dementia specialists and mental health specialists in there. We trained up staff to use the tablets. We had to change the culture to ensure that people felt familiar with the tablets and that they felt enough about themselves that they could use them therapeutically. So barriers were broken, leaving tablets out, using them in groups, using them for one-to-one sessions. We had them for recovery purposes, education, relaxation. And it was just mind-blowing to see things that you take for granted at home. You know, oh, I've thought of this, I'm going to look on a tablet, I need to do that, I'm going to use the internet, to be really embedded into older people's units, because it was a concept that not many people thought would be, you know, successful and achieved, and it went down really, really well, and it's something that I'm hoping that we could look at again. So that was my sort of introduction to mHabitat, and it really struck me that the co-design and what they were trying to achieve with digital wasn't so far out there that it wouldn't affect everybody in a really positive way. And that's what made me move the shift from clinician to mHabitat. So now that we've done our little bit, I'm going to hand over to Alison and Toby.
Thanks, Gemma. Morning, everyone. Really good participation rate I can see there. So I'm really pleased that you've joined us this morning for our breakfast. So as Gemma said, I'm Alison. I am the programme lead at mHabitat. I've worked for Leeds and York Partnership Foundation Trust, which mHabitat is part of for crikey, about 14 years now. Predominantly in health informatics, and I moved over to mHabitat just over 3 years ago. I guess I've been involved in 3 major projects in the time that I've been with mHabitat. One was part of the widening the digital participation with Pete Nuckley. Roz mentioned it briefly at the beginning. One was a citywide digital practitioner, again working with the council. And then I guess the most significant and the most wide-reaching was Loop, which we're going to talk about today. So I am joined by Toby from the Leeds City Digital team. Toby, would you like to introduce yourself?
Yeah, sure. Hi, everyone. Good morning. Yeah, I'm Toby Page. So I'm a solution architect working for the Leeds City Digital Partnerships team. So we're a team that's hosted by Leeds City Council, but we're actually funded by and work for all the NHS trusts in the city and the council and the CCG. And we kind of our team's goal and aims all relate to outcomes in the Leeds health and wellbeing strategy. So we're interested in anything relating to health and care and digital platforms to support those outcomes.
Thanks, Toby. So Loop stands for Leeds Open Online Platform, which sounds a little bit technical and jargony. What it really means is that the aim of Loop is to have one source of trusted information. So Nicola and Sana were talking earlier about MindWell and about the information that they needed to put out during COVID, but actually they'll have services on there that they signpost for people who are looking for mental health support, and that goes for any service, any charity, any NHS service throughout the city. What Loop aims to do is hold just one record that everybody else can access, slashing time for not just practitioners, but it means that citizens have got a trusted way of quickly finding exactly what they mean. So in a nutshell, that's Loop. Now, we worked in collaboration. I mean, this has been bubbling for perhaps a couple of years when we first had that idea about, actually, I think we could do something much better here, much better for the people who are accessing our services, much better for citizens. And that was a conversation in the early days between mHabitat and Leeds City Council. And then we got some funding to do something really quite wonderful in those early days. And that's when we brought in the Leeds City Digital team, NHS Digital, who were really pivotal in helping us shape that. And so if I can just move on to the next slide, please, Kirsten. So I'm not going to go through all of these, but this is the community of people that we engaged during Loop. And it wasn't just in the city, but wider. And Toby will just touch on that in a moment. But in here you can see there's NHS organisations, there's commissioning groups, there's councils, there's innovators, creators, charities, third sector. And a core of those were part of the project team as we move forward. Next slide, please, Kirsten. So Toby mentioned briefly that they, as Leeds City Digital team, get involved in the Leeds Health and Wellbeing strategy in any way that is helpful, useful, and wherever they're needed. I guess Loop was most closely linked to the element of the health and wellbeing strategy that you'll see in the bottom right-hand corner, number 7, maximise the benefits of information and technology. And it always sounds a little bit dry, doesn't it? But actually, if we really harness the power that information technology can give us, then we can do so much better for our citizens of Leeds, so much better in terms of the public purse, if you like, in terms of making best use of that money. And then just to give some examples, then I talked about the MindWell, but if you look at number 10 over there in the left-hand corner, promote mental and physical health equality, well, we can do that much better if we can reach more people, and we can do that much better online. Now, of course, Roz mentioned earlier about people who are digitally excluded and are not online, but this particular project, we're focusing on how we can reach the masses on our online platform. Again, slightly linked to this, support people to manage their own health and well-being. Well, we can do that with the power of technology through the development of apps that people can use to manage, say, for example, their diabetes or their blood pressure or whatever it is in terms of their own health presentation. Giving people information like MindWell has a wealth of information to support people who are perhaps suffering from grief, anxiety, suicidal ideation. So there's a wealth of things that Luke can do to help. So Kirsten, if I could have the next slide. And this is a question then that I really want to ask Toby in terms of where we started and where we are now. Toby, what are the benefits and opportunity that Luke can bring for the city?
Well, yeah, many wide-ranging benefits, really. I mean, as you mentioned, that there's kind of in our initial analysis, we found that there's lots of information, really good, valuable information out there on a variety of websites, giving people really good information about health and care and well-being services. And that's really grown over the last few years. But we also, during that analysis, we recognised that there's lots of duplication, as you said. People have similar records about the same services or resources, and things might be missing. And it does kind of undermine that trust in the information that people kind of find when they're looking for things to support themselves. So we've kind of we pulled all that together, and it really helps benefit the city in different ways. So there's obviously a kind of administrative benefit from doing things once, so managing those records once. But there's also a much more powerful benefits around how people query that information. So if you're looking for something to support you, Luke will give you a kind of a structured way to kind of best understand that information according to your needs, really. So what it does, I won't go into the nerdy technical stuff, but we apply a taxonomy, a classification system onto this information. So it lets people find information in a lot more targeted way. So they might want to be interested in a specific service type, or they might want to ask questions around their needs or their circumstances, and they don't necessarily have to articulate this in any technical way. It's just how things are presented on different websites in the city can be a lot more targeted. So, for example, you might be I don't know, over 50s, suffering from diabetes and looking for ways to improve your exercise. And Loop will the way that we classify information in Loop will allow you to do that. Allow you to find, I don't know, a running group near you or a weight loss support group, things like this. So there's lots of benefits. As we mentioned, we're talking about MindWell earlier. I mean, there's an incredible amount of commissioned information in the city with a lot of value and not necessarily being found in as many places as it could be. So and things like we're working closely with the MindWell team around how we get information like that, really valuable stuff, and get it in front of a wider set of users, and allow people to understand what services are available in the community. And this, I suppose, at the end of it, this supports people to better self-manage their conditions, maintain their independence, and just improve their general health and well-being. So this kind of accessibility to information is the key benefit. Yeah. And what we're doing, this is across different groups. There's obviously the citizens of Leeds at the top there on the right, but also we allow system access for health professionals, social prescribers, and then also at the end of it, in terms of commissioning decisions, we can use information in the system to help improve services.
Yeah, thanks, Toby. I mean, it really is endless. And, you know, if people have got questions, then please do drop them into the question and answers. I know that I know we're just ever so slightly over on time. So what I'm going to do is I'm going to hand over, thanks Toby for that, that was really great, hand over to Fran and John for the next interview.
Thank you, Alison. Hi, everyone. My name is Fran, and I am the project manager here at mHabitat. I joined the team in 2016, and yeah, I've been here ever since. Thank you so much for joining us this morning, and I hope you're enjoying this session so far. I'm trying to keep it on time, so I'll just go right in. Last but not least today, we've got John Fordham, Digital Navigator at Yorkshire and Humber AHSN. Hi, John, and thanks for joining us today and taking the time for being with us. Thank you. We are going to talk about a program that we've been working together in the past couple of years called Propel. And although the slides give it away a little bit, would you like to tell us a bit more about the program? Who is it for? How it works? What was the vision that was set when you set out on this project?
Yeah, so I work for the Yorkshire and Humber Academic Health Science Network, which is a very, very long name. And essentially there's 15 networks around the country, and we work with the NHS to understand their needs and work with local businesses within our region to kind of understand their solutions and hopefully match those two together so that we're kind of solving problems. So one of the key things we do is about working with businesses to help them develop their ideas and basically kind of move them forward quicker than they otherwise would do if they were just kind of left to their own devices, really. So that was kind of the HSN's remit, really, is that kind of, you know, supporting businesses and looking at this kind of strength of the region. You know, what have we got in the region that you know is our kind of showpiece, really, and kind of digital health is clearly one of those things which as a region we're very strong in, and the HSN had been working with mHabitat as well in terms of kind of discussing, you know, how we can work together, develop kind of a partnership. So the Propel program was kind of developed you know, as a joint piece of work, really, between the HSN and mHabitat to kind of see how, you know, how can we go about helping companies in our region using kind of the skills we've got in, you know, in organisations such as mHabitat, and, you know, developing, helping them move forward in a quicker rate using our networks as well. So I think we kind of saw it as a, you know, it's a strength of our region, and having obviously the strength of mHabitat there as well, it seemed like a good thing for us to do in this particular area. So Propel kind of, we sort of first started it was almost 2 years ago now. We started on working on it together, and essentially last year we took 6 companies through a 6-month program of support based in Coast Base North, and it's kind of about, you know, getting to know the NHS from the inside. It's about looking at the kind of developing an evidence base to support solutions, and kind of really kind of getting under the skin of, you know, clinical safety and everything you need to do in order to move things forward with in the NHS as well. We also had quite a lot of more kind of general business support as well. So through the partnerships that evolved through working with mHabitat, working in Coast Base, more kind of general kind of business functions. So things like cybersecurity with Accenture was one of the good sessions we did. Hill Dickinson solicitors supporting us with legal information as well. So there's very much working, you know, pulling in kind of the expertise from different areas into the program to help support us was a key bit, and working with mHabitat as well kind of strengthened that, and, you know, using their links, and it really did bring that kind of extra element to the program, really.
Oh, thanks, John. Although you already touched upon some of the benefits of the program, but would you like a little bit to expand on this, and what is the future looking like for Propel? What are the possibilities for this piece of work?
I think the key bits we always find, the classic quote from last year was always like, "Oh, I wish I'd known this a year ago. Wish I'd known this 2 years ago." In terms of the things we cover, I think in terms of the benefits, we can understand that you know, people coming through the program all have very different backgrounds, different experiences. We have clinicians who have great ideas, but don't know anything about how to run a business. We've got people who come from a business background, but don't know anything about the NHS, and people in the middle of that as well. So I think one of the strengths we had is we kind of pretty much covered everything, which, you know, it's not relevant to everyone, but we kind of, you know, there's something in there for everyone, I think, in terms of what we're doing. So there's the more practical, you know, benefits of being part of the program, but also being on the program itself is just in terms of raising the awareness of companies and their products and solutions, is that kind of extra kind of intangible factor, really, I think we hadn't really sort of planned on as being a key benefit of the program. But in terms of the awareness of the companies that have gone through the program last year, it's kind of, you know, it's shot up in terms of, you know, just people knowing, you know, becoming kind of familiar names, really, far, you know, in a far greater way than they otherwise would do, really. So in terms of the future, we've just closed applications for our kind of second cohort last week, and we're kind of assessing those at the moment. We've got a selection day planned in a couple of weeks' time, and then we're doing a launch in a few weeks after that. And then, yeah, the program's starting again, delivering kind of November time. And I think, having worked through it last year, you know, it's very much working, you know, in partnership with mHabitat, developing the program, and, you know, sort of developing those initial relationships with other organisations. Through the strength of that, we've got more partners on board this year as well. So Leeds City Council supporting us. We've got Nexus at the University of Leeds is supporting us as well. Hill Dickinson Solicitors is supporting us as well. And also we're working with Barclays Eagle Labs, which is a kind of national network of, you know, 25 locations supporting businesses in all the different ways, really. So we've got I think from what we did last year, people have been involved in it. They saw the benefits of getting involved, and it's all, yeah, sort of heading in a very positive direction, really. I think ideally we want it to be self-sufficient. We want it to be, you know, it can stand on its own 2 feet as well. So the HSN is kind of still funding a large portion of the work we're doing, but I think as a city, you know, we're doing a lot of work which is kind of benefiting lots of people in lots of different ways. So the end game hopefully will be, is, you know, where it can kind of stand on its own 2 feet financially, and kind of run from there. And I'll be happy with that.
That's great, and we are really looking forward to start working together again this year. As we all know and experience, this year has been a bit challenging, but it hasn't stopped certain things from happening, thankfully. In fact, we are close to launch, as John already mentioned, this year program. Would you mind telling us a bit more about what has changed between last year program and this year, and what impact this has had on the program itself, but also on the participants, people involved?
Yeah, so I think we had started opening up applications in January this year. So we had gone through that process of getting people to apply, and then just towards the end of that window, that's when sort of lockdown kind of kicked in, really. Yeah. And then we had to sort of take stock and replan, really. So as an HSN, all our kind of, you know, ongoing projects were kind of paused at that point, because we were shifting our focus to supporting the NHS in terms of the immediate pressures. So everything kind of was paused for a while. And we had a plan of, you know, if things are back to normal again in the autumn, let's go from there. But you know, we are where we are now, and I think the decision was made to shift to a virtual delivery. So previously we'd done everything, you know, everything physically in a room with people in workshops. We did sort of big events, speaking events, you know, networking sessions, all those sort of things were kind of part and parcel of the program itself. But, you know, to keep things moving forward, we've adapted a virtual delivery approach to the program. And that's brought lots of benefits in terms of the ability for people who are further away to engage more easily with the program itself. So I think we've had more applications from outside the region this year, because they can, you know, engage just as well as people from within the region, just because, you know, it's easier from that point of view. But I think the challenges are the events, the networking, the chance encounters, I think, which people had, which, you know, very hard to quantify. So I think that's the challenges in this sort of virtual settings. How can you replicate those, you know, those evening social meetups in the same way in a virtual method, really. So I think that'll be the challenge for that, I think.
From my personal point of view, like I've been, you know, I'm doing a course at the moment, and I've been like attending loads of events, and it's really, although it's not the same as the physical environment, it's really nice that people are really keen on chatting, loads of conversation on Twitter going on, and I know that it's not quite the same, but it's still feels very much that we are linked together. So it's really nice to sort of to look at this from this point of view as well. Before we wrap up, what was your favorite moment or moments on the project, if you have any?
I think there were sort of two really. I think the one that always kind of, there's a good photo of it somewhere, was when we were doing this cybersecurity with Accenture. We were talking about you know, protecting your businesses, you know, from threats and all those sorts of things. And as we were sort of in the middle of the session, these, I think, two men kind of abseiled down the side of the building in balaclavas and hard hats and things like that. And it did look like, and just kind of hovered around looking through the window. Obviously they were window cleaners, but it did look kind of, yeah, they did look suspicious, and gave us quite a funny moment on a session as well.
Mission Impossible style.
Yeah, we were on the 11th floor, I think we were on. So it's, yeah, it's a long way up. A big effort to kind of earwig on what we were doing. I think the other thing was we had an opportunity to present Propel and DigiBeat there as well to the Lord Mayor of the City of London, which was kind of a completely random kind of chance kind of opportunity we had. But just kind of reflecting back, it was just such a kind of, you know, an unexpected, you know, opportunity to be there at that time doing that, and never would have anticipated at the start of the program that's the sort of thing we would end up doing, really. So I think that was the other, yeah, kind of a bit of a pinch you moment, saying how did we get to this point? But yeah, no, it's been some good memories, and yeah, hopefully quite a few more memories for the next cohort, really.
Thank you so much, John. And over to you, Roz, and apologies that I ran slightly late.
Yeah, I'm very quickly going to wrap up now because it's 10:01 and we're over. We obviously have too much to say. We've been you know, having a really busy year despite lockdown. So thank you, everyone. Thank you very much for our contributors. And I hope what we've got across is that, first of all, we really want to work really hard on making sure that everybody benefits from digitally enabled health and care. And we do tackle that inequality. If there's anybody out there that is interested in working in partnership with us, or just wants to swap notes, please do get in touch, because you know, we're far better together. Thank you very much, everybody, for joining in, and thanks to the team and all our partners.